Hello everyone, this is PNG Tonight. I'm John Higgins. Coming up, cancer unit in dire need of repair and new equipment at Engau's Memorial Hospital. Homeless, a growing concern in cities and towns of Papua New Guinea. And graffiti, an act of crime or creativity? Cancer unit at the country's second largest city of Leh is in dire need of repairs. In operation for more than 6 years, the machines either need urgent repair or replacement. We look at the difficulties faced and the pleas for more help to improve the cancer unit. Kevin Deonga visited Engau and filed this report.
They have been functioning for 6 years, and the inconsiderable amount of difficulties they go through each year is immense. Chief Oncologist Dr. John Niblett says the equipments that are currently being used to treat cancer patients are in dire need for repair and replacement.
Now, I'm sure you're aware that cancer treatment is a multidisciplinary treatment, and it requires radiotherapy, surgery, and anti-cancer drug chemotherapy.
He highlighted 3 main challenges of the unit, saying that it is currently facing problems with its cobalt source that is very low and is 5 years due for replacement.
Now, we have experienced some considerable difficulties this year with our equipment. And number one, the cobalt source is very low and is 5 years overdue for replacement. I've been asking for a replacement for the past 5 years through the health department, and I think if you want an explanation as to why that hasn't happened, you need to ask them in Port Moresby. The other vital piece of equipment that's giving us a problem is the simulator, which is essential for accurate radiotherapy planning. That has been broken down since July and again has not been fixed. We hope it'll be fixed in the new year, but we have been hearing that story for some time.
Among many problems faced by this important facility in the country, the Cancer Treatment Center in Engau Memorial Hospital in Leh is also facing an acute shortage of cancer treatment drugs and chemotherapy equipments. The unit is in dire need of supplies and is lobbying to the government and health department to look into the matter as soon as possible. These problems mentioned by Dr. Niblett is a serious deficit by the cancer unit. He says these machines play an important role in treating different types of cancers among the patients.
We've also not been able to fulfill the promise of brachytherapy, which is the internal treatment with radiotherapy, because we've not had sufficient nurses despite requests to Department of Health and Engau Hospital. So we have some serious problems to contend with next year if we're to really treat patients accurately.
The simulator is another machine that is essential for accurate radiotherapy planning, has broken down since July, and the brachytherapy unit is unsatisfactory, and due to insufficient number of nurses monitoring patients, it has added more problems.
The main equipment is the cobalt radiotherapy machine and the simulator which we use for planning radiotherapy treatments. We also have a brachytherapy facility with radioactive sources. In the last 12 months, the health department has not resupplied this department with the drugs that we require. We're very short and don't have much left. And some drugs are completely out of stock.
Dr. Niblett says these challenges are a serious deficit in the department, but despite being faced by these challenges, cancer patients have shown improvement in the radiotherapy treatment.
So in terms of remission with cancer of the cervix, most of the cases that we've treated with radiotherapy have improved, and we've seen a significant decrease in symptoms and the tumour in approximately 75%. Could be more.
However, many patients do not follow up after receiving treatment because of the geographical challenges, as many of them live outside of Lae and it's costly for them to travel. He urged referral hospitals to organize travel arrangements for patients, as it is their responsibility.
We always ask the patient to check with their referring doctor when they go home so that he can follow them up. But it only happens in a few cases.
Among other technical issues, Dr. Niblet says there isn't a proper cancer registry system in place to point out accurate data and tally on patients, but are working towards achieving one.
We do not have a proper cancer registry system in place anymore, but we are working on that. Again, it's a manpower thing, and the amount of staff that committed to doing the cancer registry are part-time for our own existing staff, and that's not satisfactory.
In the meantime, Dr. Niblet is appealing to the Department of Health to take cancer treatment seriously and equip the unit with manpower and equipments for the benefit of the people.
The main challenge for cancer treatment is to have the facilities to do it properly. We have the facilities, they need to be refurbished, and in terms of the drug situation, we need to have a new supply of drugs. Given us that, we can do a lot for cancer patients in Papua New Guinea with very little resources. That enables us to do the best we can, and we're not able to do that because of poor backup.
Kevin Deonga reporting there. Stay with us for more.